you want me to just dive in, Jennifer? Okay.
Dive right on in.
Perfect. So I'm here to provide some context and information around our mandate, our legislative mandate, both funding and a directive to implement a pilot program for a pediatric transitional care facility. That may be a new term to folks. PTCF is a subtype of a RTF, a residential treatment facility. The legislative directive includes that this PTCF has to be in Spokane County, for which there's only one. And so what we are required to do is implement this 2-year pilot program around the services that are being provided in this PTCF, Pediatric Transitional Care Facility in Spokane, and also to evaluate this facility that is providing services both to newborns who have had prenatal exposure to a substance that may lead to physiologic dependence, as well as to their birth parent in those cases where birth parent is also staying at the PTCF, which is allowed and encouraged, but is not always appropriate or something that is feasible. The amount of funding is here on the slide, so you've probably already seen that. This is over 2 years, 5.5 million. Of that, 190,000 is specifically allocated for the evaluation. The remainder of that is going directly to the PTCF for providing the services at the facility. There on the right-hand side, you see what our specific requirements or directive are from the legislature. What are we required to look at in evaluation? I already mentioned that broadly, the efficacy and the outcomes and the impact of these services. Also, any information that we have and can summarize in terms of how those services were able to avoid more costly medical interventions. And then the second bucket I already covered. We are required to have a report submitted to the legislature with our findings. And that legislative report is due to the legislature by December 1st, 2024. Next slide, please. So where are we? The funding and the mandate both sort of went into effect July 1 of 2023. So we're about 2 months post that. We have executed the contract, finalized, signed by both organizations, both the HCA and the PTCF in August. So that was pretty an amazing turnaround. Super thankful to our contract staff and others who made that happen despite a really high volume of contracts. The initial payment to the PTCF is in process. We are still working. The second bucket just sort of illustrates we really did develop and co-developed a pretty detailed contract with the PTCF. In that contract includes quality of care and definitely focuses on evidence-based best practices and really a dyadic lens. So that's both the infant and also birth parent. We are in final negotiations for the other required contract, again, which is with Washington State University for the evaluation. We're getting close. We're just sort of in that final back and forth stage, I think. Hopefully, fingers crossed. We also co-designed that evaluation with WSU research team, really making sure that our agency priorities in terms of this population are presented in the evaluation. Next slide. So some of this now I've already said, but super appreciate Jennifer who put together these beautiful slides, just giving sort of a visual. So July, again, was when the mandate and funding began. You see there next in August, we executed the contract with the Pediatric Transitional Care Facility. September, we expect that we will finalize the contract with WSU. Over this 2-year time period, we have quarterly deliverables and reports and associated payments, both for the facility and also for WSU as the evaluation team. We will have quarterly meetings with both contractors, sort of standard, and then others ad hoc or as needed. We will get the final reports. Again, whenever we have a legislative report due in December, we have to back that up quite a bit for our own internal processes. So we actually have in the contracts that the reports are due to us from both WSU and the PTCF between July and August of 2024. And then we will submit that legislative report as directed by December 1, 2024.